Honorable Prime Minister, first and foremost, I would like to introduce Professor Manfred Dietrich. I will ask Dr. Ben Mbonye later on to just say a word about Professor Dietrich, but what I would say now is that his love for Uganda is self-evident. He's currently Uganda's consul in Germany. He's our diplomat in Germany. Although he's not with us yet, I would want to also introduce Dr. V. Jagdish. He previously worked with the World Bank, and again, I will ask Dr. Ben Mbonye to say a word about him. This is a gentleman who helped us start. Then I would like to introduce Professor Henry Boom, representing our partners from Case Western Reserve University. I would like to say that Joint Clinical Research Center perhaps has got the biggest repository of medical research and clinical specimen in the whole of East Africa. It is behind this building, and Professor Boom contributed to the cost of building that center. So, no apologies for making this an occasion of thanking people who have really helped us. In the same vein, I would like to introduce, when you read many articles, you'll find Dr. Mujenyi is the founder of JCRC. What a great nonsense that is. The real founder of JCRC was the president, and the person who was the director and the person who started it all is Dr. Ben Mbonye on behalf of the president. While he was the director, the chairman of the board was His Excellency the President. If you can get the president being the chairman of your board of trustees, then you are not a small thing. But here, after the president, we are proud to have others who followed in his footsteps. Among them is our own Crispus Chionga, Honorable Dr. Crispus Chionga is over there. We had Honorable Amama Mbabazi and Honorable Dr. James Makumbi, who followed, and currently we have Professor Eperu Opio, who is with us. So there are many other distinguished guests. I thank very much my colleague, Dr. Sisechitio, for welcoming them. Now, 25 years has been a long journey. It has been highly eventful, at times challenging, lingering on frustrating and exasperating, but ultimately very highly fruitful journey that we have gone through. And regarding how we started, I'll let Dr. Mbonye say a word about it. That was way back in 1991. But Dr. Mbonye was on the helm for 1 year. Then I surfaced. That was in 1992. At the time when the Board of Trustees appointed me as the new director, they gave me 2 pieces of shocking news. The first one was that I would have no salary. And the second one, they told me I would have no funds to run the center. Those were the news that welcomed me here. And the chairman who said those words will soon be here. Then they brought the second piece of news that I was to raise the money together with my staff and run the center, and that from time to time, government would help whenever they could. And if you recall, it was a very difficult time way back in 1991, 1992. But since that time, the achievements of JCRC have been remarkable. It's good. It's good that we started at the deep end. We could not go down anymore. The challenge of the work we had to do was very, very big. So let me just mention a few of the achievements. First of all, maybe we start with the infrastructure, because this is something we can all see with our very eyes. There is nothing abstract with it. We can see it with our own eyes. We started at Mengo, where we were housed in one residential house of the former Katikiro of Buganda. My office was in the Katikiro's kitchen. But before we left Mengo, we didn't just leave it as we found it. We had built on that campus 6 new buildings, including a ward, outpatient clinic, a new big laboratory, a freezer room, and these were just among other buildings that we left in Mengo. The new infrastructure we left there now houses an entire branch of Mukono Christian University. The second achievement, we built JCRC Center and advanced laboratory in each region of the country. Each region of Uganda, JCRC built a center. And the center that we built in every region of the country was at least twice as big as Mengo, which we started with. These centers were in Guru, Fort Potro, Kabare, Mubende, Kachira, Mbarara, and we renovated Mbare. That's what we did from 2003 to 2008. And in this, we thank our partners, USAID, who had given us a project treat with which we used the overheads and on top of what we generated ourselves from our own resources to build those centers. Then, now, ladies and gentlemen, we have Lubowa, where we are now. Lubowa is 25 times the size of what we started with in Mengo. I would also say something about human resource. We started with a staff of 17, of which only 7 were scientists. They included Dr. Samson Chibende, who has just recently retired, Mr. Sam Rwakojo, who rose to become in the that's Electoral Commission, Dr. Njanabanji, Mr. David Mwine, Major Rubaramela Rulanga, he's over there. Naume Komhanji Kato, Sister Mulindwa, Mr. Stefano Tugume, who has just retired. And of particular pleasure, we still have some of those here who were here with Dr. Mbonye. John O'Croll, please stand up, he's over there. Rose Byaruhanga is over there. Santrina Bato. Dina Tumukunde. Winfred Chiimba. Disan Murima. Alfred Tumwesije. And finally, Paul Twise Achari. We started with 7 scientists. Currently, we have 300 employed by JCRC. We had 7 scientists. These are people with at least a bachelor's degree in science. But now we have 150 scientists. Our ranges of qualifications range from PhDs. We have several of those. The majority have master's degrees, and others have got advanced qualifications, mainly with a minimum of Bachelor of Science or equivalent in various subjects. So in human resource, we have made some progress. Just a word about the treatment of HIV. Supercharger, thank you very much for telling us about the history, and thanks for presenting people who came to us when they were children. 2 of them have graduated. Others have had children, and all the children born of JCRC clients, all of them are HIV negative. Dr. Mbonye started the research with AZT study. It was a drug which was the only one at the time in 1991. Joint Clinical Research Center was the first in Africa to test that drug. It was a toxic drug, but JCRC found safer, lower doses which would do equal work, and these were not as toxic as the doses which were being used at the time. From 1995, when effective treatment became available, the first country in Africa to use antiretrovirals was Uganda at JCRC. In 2003, President Bush announced PEPFAR program, and the first country to get a PEPFAR grant was Uganda, and it was through JCRC. In the program named TREAT, which was the first one, it was like a demonstration project for the world, because no other existed at the time. And by the time TREAT ended, 100,000 HIV-infected patients had been started on antiretroviral therapy. And 400,000 patients were in program care. And 75 satellites had been established by JCRC, working with the Ministry of Health throughout the country. What pleases me most is that most of those were successfully transitioned to the Ministry of Health facilities, and those who have followed up those patients find they are getting good care in the Ministry of Health facilities, equivalent and sometimes better to what we are giving them when we run all of those centers. So thanks everybody who worked in TREAT. Then just a few remarks remaining about, I can't mention each and everything that we have achieved, but we wouldn't be correct to not mention something about research. JCRC carried out the very first HIV vaccine research in Africa. We also carried out the very first HIV studies using antiretroviral therapy. Since then, we have undertaken over 100 research projects, major research projects, including clinical trials, studies on opportunistic infections, HIV resistance, and this is among others. Now, our publications, this is the measure. If you say you are doing research, the only evidence you present is publications, not in the second area. It has to be publication in the peer-reviewed medical journals. And I'm glad to say that we and our partners whom we work with, our publications are running in thousands, not hundreds, but thousands. Some of them have been listed in our the magazine we have given you. But the good thing these days, we have internet. All you need is to look there. Your computer will light up with the work that JCRC has done. We have also been involved in training, building capacity. But this has not only been in Uganda, it has been in many other countries. We have had a program called African Dialogue on AIDS, centered here at JCRC, in which all the countries in Africa, Caribbean, some Asian countries were trained, coordinated through JCRC. Now, I'll end with some word about the future. We have now celebrated 25 years. So we are now on a countdown towards the Golden Jubilee. Golden Jubilee, that will be 25 years from now. We are under no illusion to the challenges that are ahead of us. We fully understand that we must intensify our efforts through novel and innovative initiatives to address the new and emerging diseases. Our vision of the future is to diversify beyond HIV/AIDS. And we have already started. We are building capacity in other branches of medicine to address emerging diseases that continue to crop up every time. And we are adopting emerging technologies. Next week, we are getting one of the latest technologies to separate the cells. Leukapheresis machine will be installed here. And this will be the first in the region, and we hope will be a referral center using this new technology that will be installed here. This is the direction which JCRC must now take. However, to succeed in the next phase of our work, we need continued partnerships with all of you, our partners. All of you, Dr. Chitio has thanked you from Makerere, from other organizations, from USAID and others, and we need your continued support and working together with us as we have done. And we also, through our Prime Minister, Honorable Ruhakana Rugunda, ask the government. The government has done a lot in support. Recently, the president came over here and helped us by completing the last certificate of the building of this center. And the government, through His Excellency, has always supported us in so many other ways. And through you, Mr. Prime Minister, we ask continued government support. And we already now have 2 people in the Ministries of Health who have linkages with us. And so, Honorable Prime Minister, they will not be difficult to you when you talk to them. Thank you, Honorable Prime Minister. Thank you, our distinguished guests, and all my colleagues at JCRC, our clients who are here in strength. And before I end, Honorable Prime Minister, I want to mention one lady called Zikola. Can you stand up? That is an elderly lady. That lady has taken on orphans and looked after them single-handedly. These were orphans whose relatives had given up on them. She took them up, and she came to us many years ago, and she nursed them. There is a story which you will be reading in one of the books, because I wrote about it, where one of the child almost died, but she persisted with that kid. That child is now a university graduate working for JCRC. So thank you very much, everybody, for God and my country. So we are conscious of the Prime Minister's time. We are grateful that he's been able to give us this time. We know how busy you are, Honorable Prime Minister, but we would like to invite a few people to make a few remarks. We'll start with Dr. Ben Mbonye. Dr. Ben Mbonye, then we'll ask Professor Dietrich after him to just make a few remarks, and then we'll be following on. Dr. Ben Mbonye.
Thank you very much indeed, Professor Mjenyi. Our guest of honor, the Right Honorable Dr. Ruhakana Rugunda, the Prime Minister of the Republic of Uganda, the Chairman of the Board of Directors of Joint Clinical Research Center, the past chairpersons and members of the board, the Director of JCRC, Professor Mjenyi, and your staff, ladies and gentlemen. Guests of honor, allow me to congratulate Professor Mjenyi and his entire staff for these 25 years of existence. Congratulations, Professor Mjenyi. As some of you know, and as you've been told, I was very closely associated with the beginning of JCRC. So I know a bit of its infancy, and I would like to see whether I can carry you through some of that time. First, when this government came in power in 1986, it very quickly realized that Uganda had a big problem of AIDS. It was an epidemic. But whereas many other countries had refused to acknowledge and accept there was a problem, Uganda, I think, was the first country in the world to acknowledge that we had a problem and we needed assistance. And I want to congratulate and thank the President of the Republic of Uganda for having been that visionary. At that time, the first person to come to go the field in that battle was the then Minister of Health, assisted by Dr. Sam Okware, who is here with us. Dr. Sam Okware was the first director of AIDS control program in the Ministry of Health. That same minister who was in the Ministry of Health that time, later on moved on to become a minister in the presidency, the minister for the presidency, and continued to be interested and guide the control of AIDS in this country through Uganda AIDS Commission, which is under the office of the president. He then later on, I think, went back to the Ministry of Health, continued to guide the fight against HIV AIDS, and now commands from the center as the Prime Minister of the Republic of Uganda, and that is none other than Honorable Dr. Ruhakana Rugunda, who is our chief guest tonight. Thank you very much indeed, Right Prime Minister, for that involvement and commitment in the control of HIV/AIDS in this country. In the late 80s, soon after, as I said, the movement took over the reins of power in this country, the scourge of AIDS was very bad. I do recall we used to travel almost every weekend to bury victims of HIV/AIDS. We had lots of orphans who didn't have any care. Thanks very much indeed, Sikora, for your interest in orphans. We had homesteads which were being run by under 10s because their parents had gone. We are losing senior government officers, senior security officers, and there were tears in almost every family in this country. So we were faced with a security problem, an economic problem, political problem. It was a crisis. And that is when His Excellency the President moved on and directed that we must establish a research center to find a cure on AIDS. At that time, nobody in the world talked about a cure. Everybody talked about control and counseling. Nobody talked about a cure. So at that time, for him to have come up and say, I direct you to go and find a cure, establish research to find a cure for AIDS, was a tall order. We didn't know what to do. The first stopover was in Hamburg. In Hamburg, some of the officers we had who had AIDS, we used to send some of these patients to Hamburg and for treatment of complications and superinfections and all that, but not a cure for AIDS. I was told when I reached there that it was not possible for them to get involved in the cure of AIDS. But he said what he had, he was going to give me, and he simply gave us the first equipment for Joint Clinical Research Center, and that was a dark ground microscope for assessment for determination of the levels of CD4 count as progress of the disease. After that, he simply said, I'll give you some stuff to carry out research with you, and I will train some of your personnel. And he's the one who trained some of our first laboratory technicians at JSRC. And that person is none other than Professor Manfred Dietrich, who is with us here this afternoon. Professor Dietrich was also, that particular time, appointed as a director, one of the first directors at JSRC, and still is. And he continues to be interested in the affairs of Uganda and is currently our honorary consul, Uganda honorary consul in Germany. Thanks very much indeed again, once again, Professor Dietrich. The second stopover was Washington. In Washington, we didn't know where we were going. Let me first confess this, because we didn't know where we were going. Nobody was involved in treatment. So we had been given an open ticket to go wherever we could in order to look for this facility. In Washington, Uganda had the first health project supported by the World Bank. And we talked about a possibility of helping us through the first health project. They simply said it was not possible. Nobody was carrying out any research on treatment, and it was not going to be possible. But they said, we may think about it to develop an infrastructure for you on one condition. I said, what's that condition? Provided you adopt what we have been thinking about, and that is to look at HIV, the control of AIDS, as a multi-sector problem established as a standalone project. Then once you allow us to support that, we may think about giving you an infrastructure. So I said, don't worry about that. What do you want us to do? Said, just write to us, accepting that or saying that you would like to establish a multi-sectoral program in your country. Then the issue of supporting you for infrastructure will simply follow after that. Said, how do you want it worded? They scribbled on a piece of paper and gave it to us, and we hand carried it in our pockets. We brought it and we presented it to His Excellency the President and said, Your Excellency, we have been given very tough conditions that we have to establish an organization that is going to look at the control of HIV/AIDS centered in a ministry other than the Ministry of Health as a multi-sector approach towards the control of AIDS. And if we do that, then they may support us to establish a research center. He said, can you explain to me a bit about what they are going to do? I explained it, and he said, what's wrong with that if they're going to help us control AIDS in this country? So he simply sent me to the then Minister of Health, of Finance, to send for a no objection from the World Bank. I did not know what response I would get. I got there, and within the first 5 minutes of discussion, those days we used telexes. A telex was sent to Washington, and within 30 minutes we had a response giving us a no objection to establish a research center and establish Uganda AIDS Commission. That person who was the Minister of Finance that time was later to move on to the Ministry of Health as the Minister of Health. And as you know, the Minister of Health is one of the promoters of JSRC. And later on, he went and headed Ministry of Defense and continued to support AIDS. And that person is none other than your former chairman of Joint Clinical Research Center, Honorable Dr. Crispus Chionga, who supported us for that time. The support that we got from the World Bank was led by a gentleman you have heard mentioned, Dr. Jagdish, who happens actually to be in the country at the moment, but he's involved in some discussions. I don't know, he must have talked to the director already, but he's around us, and he continues to have a lot of interest in our affairs in this country. The other support we got was somebody who was supporting us behind the scenes at that time. He was working very closely with the president. He used to write briefs for the president, used to advise him on health matters. He was involved in the establishment of Joint Clinical Research Center. He was involved in the establishment of Uganda AIDS Commission. He still is a director at Joint Clinical Research Center as well as Uganda AIDS Commission, and he's really committed even to this day. Dr. Jessica Jimba. Now, this gives you a kind of background of a few people who were deeply involved in the establishment of JSRC. Then we had to get somebody, as you heard, I was not involved in this for long, and we had to get another person to take up this role of coordinating all these activities. The person we landed on had to abandon his prestigious position as a consultant in pediatrics at Mulago Hospital and agreed to come and be located in the dilapidated building in Mengo. There was no staff. There was no salary, as you had. There was no equipment apart from that dark ground microscope, which you had, until later on when the president, I don't think, donated 1 or 2 other equipment, and that was Professor Peter Mujenyi. What I was not aware of is that he was not being paid a salary. I forgot that I moved with my salary and did not organize that one before we left. But the members of staff who he was working with that time at the Joint Clinical Research Center were people we had moved with from Buya. They actually belonged to the Ministry of Defense. What I did not know was that he did not go back. So today, I hope nobody is from Ministry of Defense today, but you are regarded as deserters, but probably they have forgotten by now. But that was the nucleus that established Joint Clinical Research Center, including a few, I think, equipment. But I think the equipment was probably sent back. But that was the beginning of Joint Clinical Research Center. Later on, after we had established that base, we heard what was going on. Before we knew what was happening, we heard Professor Mujenyi interacting with the world researchers like Professor Montaigne. We heard him as invited and recognized by the Secretary General of United Nations Ban Ki-moon, who also visited him here and recognized his services. Before you knew what was happening, he was attending the State of the Union address with the President of the United States. And later on, Peter Mjenyi came home with probably the largest fund Africa ever had. And that's what you heard him talking about, PEPFAR. That was the largest fund through Joint Clinical Research Center. Today we celebrate 25 years of JCRC's existence, but probably not existence, but success. Ladies and gentlemen, our chief guest, the people have mentioned what they started and what has been going on under the leadership of Professor Mjenyi today have made a tremendous difference in the lives of Ugandans. Today, we don't see ourselves traveling every weekend to bury victims of HIV/AIDS. That's a history. Today, the stigma that you had people have, nobody wanted to be identified as having HIV/AIDS those days. You've seen the young girls here dancing and celebrating because it's no longer a problem to them. Today, we no longer have orphans running around without anybody helping them because they're not there. The few orphans we have are because of some other conditions, but not specifically HIV/AIDS. Today, Professor Mjenyi and your team have wiped off tears of Ugandans, which they used to have those days. Today, Professor Mjenyi, with your team, you have brought happiness and smiles on and hope on the faces of Ugandans and the world at large. So therefore, as we celebrate the 25 years, Professor Mjenyi, I would like to say we are proud of you and your staff for all this achievement, and really with your team, I can only say you are the unsung heroes of this country, of our generation. Congratulations. Our chief guest, I don't have much to add. I'd like to thank you all, Joint Clinical Research and Center yourselves, and the director, your director, Professor Mjenyi, for this tremendous achievement. I thank you and wish you the best for your celebrations. Thank you.
Thank you very much, Dr. Mbonyi. Before I call the next speaker, can I recognize in our midst we have the Director for Research at IDI. You're most welcome. We have a representative from National Drug Authority. We work very closely with them. We have the director and a team from Baylor College of Medicine, Uganda. You're most welcome. And of course, we have our clients. I didn't recognize you officially, but we are here because you're there. May I now invite Professor Dietrich. I think they've already touched on him and what he has done and what he did when we were starting the JCRC. Professor Dietrich, you're most welcome. He flew all the way from Germany to be here today.
Thank you very much. Honorable